Medicine has made numerous advancements over the past few years. During my more than 3 decades in practicing orthopedic surgery, I performed thousands of total knee replacements with local hospitals. Did you know that there are over 206 bones in the human body, and that these bones, in connection with specialized tissues known as ligaments and cartilage, form the joint? Joints aided by these structures allow the bones to move freely against one another without any significant friction. All joints rely on healthy and strong structures to sustain body weight and the impact of everyday activity. For example, the knee moves several hundred, if not thousands of times each day, walking, climbing, bending, climbing stairs, and participating in sports activities. With this in mind, let's take a look at the special anatomy of joints. You may ask why freely movable joints such as the hip, knee, ankle, shoulder, and elbow are injured to the point that requires joint replacement. The reason is that these joints are under constant demand for performance. The tissues and fibers within the joint may be injured or simply wear out with time. The most common reason for joint replacement are persistent conditions of pain, restriction of motion, and severe fractures that crush the bone and cartilage of the joint. Deterioration of the joint is another reason due to chronic arthritis or some degenerative diseases such as osteoarthritis, rheumatoid arthritis, avascular necrosis, or post-traumatic arthritis. Your surgical procedure may last from 1 to 3 hours depending on whether it's a primary total knee or a total knee revision. Total joint replacement is a major surgical procedure, and as with all surgeries, there are potential complications such as risk of bleeding, blood clots, damage to blood vessels and nerves, persistent pain, or infection within the joint. Infection can occur despite proper surgical procedure and medical treatment. Precautions include preoperative antiseptic scrubs and washings of the leg before surgery, as well as administration of antibiotics. We, your surgeons, will also wear special isolation suits or space suits for added precaution. As with any joint replacement, there is a slight chance of prosthetic failure. This may be caused by dislocation, excessive wear, or excessive weight of the patient. Overweight patients are advised to lose as much weight as possible before the surgery as well as after. A total knee prosthesis is designed to provide a normal range of motion in the patient postoperatively with respect to both bending and straightening. The expected range of motion following joint replacement on the knee is for a patient to be able to move their knee from a fully straight position to approximately 120 degrees. Although the knee prosthesis takes the place of the surface of the joint, the muscles, tendons, capsule, and ligaments all remain as original equipment. There are several types of prostheses available on the market today. Most are composed of metal and plastic. The metal, which makes up the femoral portion of the prosthesis, is either stainless steel or cobalt chrome. The plastic is a high-density polyethylene used for the cushion between the two metal surfaces. It moves well against metal, resisting wear, cracking, and providing a low-friction, weight-bearing surface. When the knee joint is healthy, it's a remarkable mechanism. The healthy knee joint is formed by the top of the shin bone, called the tibia, and the bottom of the thigh bone, called the femur. Your kneecap is the patella. Cartilage provides padding between the bones and helps assure an effortless, smooth, gliding motion of the joint. The lining around the knee produces a lubricant that contributes to the smooth movement of the knee. When arthritis occurs, the knee is unable to effectively cushion the body from impact and stress. The result is erosion of the cartilage and pain that can gradually hamper your quality of life, reduce your independence, and make it hard or impossible to do the things that you want to do every day. Total knee replacement surgery is an excellent operation for the relief of pain. 100% pain relief is not expected due to the muscles, tendons, ligaments, and capsules remaining in their original state. However, with good results from a total knee replacement, you can expect to walk into a new and expanded life of activity.
To find more information and view animations about total knee replacement and other procedures, go to orthopedicspecialistla.com/Waddell. You can also find us on Facebook.